The first 5 signs of breast cancer most women miss. What if the earliest signs of breast cancer aren't what you think they are? While most women check for lumps, there are 5 subtle warning signs that appear months before a lump can even be felt. These signs are so common that most women dismiss them as normal changes or minor annoyances. But recognizing these early warning signs could literally save your life. Today, we're going to explore the 5 earliest signs of breast cancer that most women completely miss. By the end of this video, you'll know exactly what to look for and when to seek medical attention. Sign number 1. Unexplained breast pain or tenderness. Most women have been told that breast cancer doesn't cause pain, but this isn't entirely true. While breast cancer pain is different from the cyclical breast tenderness many women experience with their menstrual cycle, it can be one of the earliest warning signs. Cancer-related breast pain is usually persistent and doesn't change with your monthly cycle. It might feel like a dull ache, burning sensation, or sharp stabbing pain that stays in one specific area of your breast. This pain happens because growing cancer cells can irritate surrounding tissues and nerves. The pain might be constant, or it might come and go, but it doesn't follow the pattern of your periods. Inflammatory breast cancer, a rare but aggressive type, often causes breast pain along with swelling and redness. The breast might feel warm to touch and appear inflamed, similar to an infection. If you have breast pain that lasts more than 2 weeks and isn't related to your menstrual cycle, don't ignore it. While most breast pain isn't cancer, persistent unexplained pain should always be evaluated by a healthcare provider. Sign number 2. Changes in breast size or shape. Many women don't realize that breast cancer can cause subtle changes in breast size or shape long before a lump becomes noticeable. One breast might appear slightly larger or smaller than the other, or the shape might change in ways that seem minor. You might notice that one breast hangs differently than the other, or that the nipple position has shifted slightly. These changes happen because cancer can affect the underlying breast tissue structure, causing the breast to reshape itself. Sometimes the breast might appear to have a dent or indentation, almost like someone pressed their finger into soft clay. This dimpling occurs when cancer cells pull on the connective tissues inside the breast. The breast might also appear to have an unusual contour or outline when you look at yourself in the mirror. These changes are often very subtle and develop gradually over weeks or months. Take photos of your breasts monthly so you can compare them over time. Look at yourself in the mirror with your arms at your sides, then with your arms raised above your head, and finally with your hands pressed firmly on your hips. Sign number 3. Skin changes that look like orange peel. One of the most overlooked early signs of breast cancer is a change in skin texture that resembles an orange peel. This condition is called peau d'orange, which literally means orange skin in French. The skin over part of your breast might develop tiny dimples or pits, making it look and feel like the surface of an orange. This happens when cancer cells block the lymphatic vessels under the skin, causing fluid to build up. The affected area might also feel thicker or more rigid than the surrounding skin. You might notice this change when you're applying lotion or during your monthly self-examination. This skin change can appear anywhere on the breast, but it's most commonly seen in the lower or outer areas. It might start as a small patch and gradually expand, or it might appear suddenly over a larger area. The skin might also become red, warm, or inflamed in addition to having the orange peel texture. Unlike a rash or skin irritation, this change doesn't improve with moisturizers or topical treatments. But here's the sign that catches most women completely off guard because it seems totally unrelated to breast cancer. Sign number 4. Nipple changes in discharge. Your nipples can provide important clues about breast health, but many women don't know what changes to watch for. Nipple discharge is one of the earliest signs of certain types of breast cancer, especially if it happens without squeezing or pressure. The discharge might be clear, bloody, or have an unusual color like yellow, green, or brown. It typically comes from just one breast and one nipple opening, rather than both breasts. Bloody nipple discharge is particularly concerning and should always be evaluated immediately. Even if the amount seems small or only happens occasionally, it can be an early sign of ductal carcinoma in situ or invasive breast cancer. Changes in nipple appearance are equally important to monitor. The nipple might become inverted or pulled inward if it wasn't that way before, or it might change direction or angle. The skin around the nipple, called the areola, might become scaly, crusty, or develop persistent sores that don't heal. This can be a sign of Paget's disease of the breast, a rare type of breast cancer that affects the nipple area. You might also notice that the nipple becomes more sensitive than usual, or that it itches persistently. These sensations don't improve with moisturizing or gentle care. Sign number 5. Swollen lymph nodes. Lymph nodes are small, bean-shaped structures that help your immune system fight infections and diseases. When breast cancer begins to spread, it often travels first to the lymph nodes under your arm, above your collarbone, or near your breastbone. Swollen lymph nodes feel like small, firm lumps under the skin. They might be tender to touch, or you might not feel any pain at all. In the underarm area, swollen lymph nodes might make it uncomfortable to wear tight-fitting bras or shirts. You might notice this discomfort when reaching overhead or during exercise. Lymph nodes above your collarbone that become swollen are particularly concerning because they're not usually affected by minor infections. If you can feel lumps in this area, it's important to see a doctor promptly. The key difference between cancer-related swollen lymph nodes and those caused by infections is persistence. Lymph nodes that swell due to infections usually return to normal size within a few weeks, while cancer-related swelling persists or gets worse over time. You can check your lymph nodes by placing your fingers flat against your skin and pressing gently in circular motions. Check under both arms, above your collarbones, and along the sides of your neck. When these signs appear together, while any one of these signs can be concerning, pay special attention if you notice multiple signs appearing together. Cancer rarely causes just one isolated symptom, so combinations of these changes are more significant than individual signs. For example, breast pain combined with skin changes or nipple discharge along with lymph node swelling should prompt immediate medical evaluation. The more signs you have, the more important it becomes to seek professional assessment. Keep in mind that these signs can develop gradually over weeks or months. You might not notice them all at once, which is why regular self-examination and awareness of your normal breast appearance and feel is so important. The importance of early detection. The reason these early signs are so important is that breast cancer treatment success is directly related to how early it's caught. When breast cancer is detected before it spreads to lymph nodes, the 5-year survival rate is nearly 99%. However, once cancer spreads to nearby lymph nodes, the survival rate drops to about 86%. If it spreads to distant parts of the body, the rate falls to 28%. This dramatic difference in outcomes makes early detection crucial. By recognizing these subtle early signs, you're giving yourself the best possible chance for successful treatment if cancer is present. Many women delay seeking medical attention because they're afraid of what they might find, or because they don't want to bother their doctor with what seems like minor concerns. But healthcare providers would much rather evaluate early warning signs than diagnose advanced cancer. What to do if you notice these signs? If you notice any of these signs, don't panic, but don't ignore them either. Schedule an appointment with your healthcare provider within 1 to 2 weeks, especially if symptoms persist or worsen. Keep a symptom diary noting when you first notice changes and whether they're getting better, worse, or staying the same. Take photos if there are visible changes to help track progression over time. Be prepared to describe your symptoms clearly, including when they started, whether they're constant or intermittent, and what makes them better or worse. This information helps your doctor determine the best course of evaluation. Remember that most breast changes are not cancer. Hormonal fluctuations, infections, cysts, and benign lumps are much more common causes of breast symptoms. However, the only way to know for sure is through proper medical evaluation, which might include physical examination, imaging studies, or other tests. Taking action for your health. Your breasts change throughout your life due to hormones, aging, and other factors. The key is knowing what's normal for you so you can recognize when something is different. Perform monthly breast self-examinations and pay attention to how your breasts look and feel. The best time for self-examination is about 1 week after your period ends, when hormonal effects are minimal. If you no longer have periods, choose the same day each month for your examination. Use your fingertips to feel for changes, and always examine your breasts both lying down and standing up. Don't forget that men can also develop breast cancer, though it's much less common. The same warning signs apply to men, so this information can help protect the men in your life too. Which of these early warning signs surprised you the most? Have you been experiencing any of these symptoms? Remember, you know your body better than anyone else. Trust your instincts and don't hesitate to seek medical attention if something doesn't feel right. Early detection saves lives, and recognizing these subtle signs could make all the difference in your health outcome.